If you don't have a copy of this book, you are really missing out. Stay tuned. Yay! I get to make a video today. I'm so excited. So I'm home. It seems like it's cooling off a bit outside, so I've really gotten back into my teas, and this is so awesome. This one is Blueberry Bliss tea from Tivana, and guys, when I tell you the tea is delicious, I mean, it's good. It really is delicious, and it just makes my environment really relaxing. And I don't know, just a hot cup of tea is everything. I guess I like it so much too because I don't drink coffee. So, and you guys have to look at the inside of my cup. It says, "Love is all you need." Love it. This book, whoa, 2016 5-minute clinical consult. I've actually had the book for about 2 months, and it's everything. I love this book so much, and do not sleep on this book, guys. It was about $95. I got it from Amazon, and I actually filmed this video like a month ago, and I'm not sure what happened to the footage, but I'm filming it again today because, yeah, I don't know what happened. So anyway, where do I get started? So the book is pretty heavy. It's pretty big, as you can see. So it is a big book, but it has to be because it has everything in it, everything. It starts out with, first of all, it's alphabetized, which I love. That makes it really easy to look things up. The very first part of the book is all algorithms. The first 129 pages of algorithms. How awesome is that? How awesome is that? And it's awesome to me because I love algorithms. So this is great. After that, it just starts off from A to Z with every diagnosis you can think of. And I'll give you guys the very first diagnosis, which is abnormal or dysfunctional uterine bleeding. And it just goes from there. Now, I had a patient, my very first patient that I treated with gout. And I'm going to show you guys, I came to my 5-minute clinical consult because I needed some really quick information as far as treatment and whatnot. And yes, I do use UpToDate and I use Hippocrates, but you all know that I'm a book girl. I love books, and I always will, I always have. I like having them in my hand. I like turning the pages. That sounds kind of weird, but it's true. So I had a patient with gout, and you guys won't be able to see this, but you can just kind of see where I highlighted certain things. The great thing about the 5-minute clinical consult is that it literally takes about 5 minutes to get all of the information you need. It starts out with the basics, and then it goes to the epidemiology, and then etiology and pathophysiology. There's a few bullet points on everything. All of the topics that I'm bringing up, there are bullet points afterwards, and it's really quick and it's really to the point. There's genetics, there's risk factors, and then general prevention, commonly associated conditions. So what else could it be? And it lists a few things. Then you go to the diagnosis. It tells you the history, so like the presentation of acute gouty arthritis. It tells you what the patient will typically have complaints about. The physical exam is there, which I really love, because when you're doing the physical exam, especially on something that you're not really familiar with, sometimes you just want little reminders so that you can make sure you don't leave anything out. That is there. Differential diagnosis is there, which I love because you always have to think outside of the box and think about other things. So that is awesome. Diagnostic test and interpretation. Who doesn't need that? It just gives us reminders of the things we should be ordering and what we should be monitoring for the different diagnoses. The treatment, which was great. You guys can, I think you can see here that I highlighted a nice amount of the treatments in this book. on gout, because I was actually looking at gout for one of my patients. And yeah, it was just amazing how quickly I could look this up. I could read the whole thing in about 5 minutes or so, and I I liked that. I loved that actually. And then after treatments, it goes on to ongoing care and follow-up recommendations as far as patient monitoring. There's patient education, which we're using gout as an example. We all know patient education is critical with gout as far as what the patient is eating and whatnot. And then what I really love is they list references. I don't know if you guys can see this, but they list references. And that's so awesome, because if you want to go and look up more information, then you kind of have where they got this information from. And I really like that. The ICD10 codes are here as well. They're the ICD10 codes, ICD10 clinical pearls. I really like that. It ends with clinical pearls, and that's awesome. So A to Z, everything I have needed information on is here in this book. The book is altogether, it's about 1,200 pages. Everything is covered. Everything is covered quickly. You know, you can read it quickly in 5 minutes pretty much. And it's very thorough. It's very thorough. I'm interested in the online version of this book, so you guys let me know if you have the online version. What do you think about it? Because I love the book so much that I'm interested in buying the app, and I have not yet, because I want to do the free 10-day trial. I got a free 10-day trial with this, and I'm really excited to try it out. So I'm going to go ahead and try out the 10-day trial to see if I like it, and I'm gonna let you guys know. Yeah, I'm not sure why the phone is ringing. So I do plan on trying out the 10-day trial, and I'll let you guys know how it goes. Other than that, the book is really awesome. The only gripe I have about it is that it's really big. But as I mentioned before, it has to be, because it's very thorough. It covers everything. So I have not taken it to work yet, because you guys know how many books I already take to work. So this one would just be over. It would be too much. So I have it at home. I keep it in my bedroom, and I like to read it at night. I like to read it when I'm comfy in bed and I'm doing my reading for the day. I like to pull this book out and read up on things. And then of course, if I encounter anything at work that I felt uncomfortable about, you guys know that my thing is to come home and research. And the first book I kind of go to at this point is the 5-minute clinical consult, because it's just so awesome. So let me know what you guys think about the book if you have it. And the other thing that I'm interested in knowing is, what do you guys think about the pediatric clinical consult? I haven't heard much about it, but I'm interested in getting the pediatric one too, and I think I might do it because I love this one so much. So let me know what you guys think, and I'll see you guys in the next one. Good luck. Bye.